Okay. Next. Okay. Next is, what is disadvantage of increasing dose? Advantage of increasing dose was also that you are able to get the exact duration of the drug. We have discussed about duration of the drug in the last class. Go to the last lecture, the last few minutes we have discussed this duration and why it is important. Number 131, disadvantages of its increasing dose. If you are giving your medicine, we have discussed also that in present day why we need to know the provings. Okay, and we have told that there are many folk medicines you will discover every now and then, and you wanted to prove. There are many medicines in Drugs of Hindustan. Sharat Chandra Bose, most probably the writer, author, he proved many drugs. He proved actually many drugs, many Indian drugs which have been used nowadays by us. Okay, so how he was able to prove? Because of this important knowledge for the Hahnemann attributed to the knowledge of physician, that knowledge of medicine in general, knowledge of medicine in particular. Now come to 131, disadvantage of increasing dose. If, however, in order to ascertain anything at all, the same medicine must be given to the same person to test for several successive days in ever increasing doses, we hereby learn no doubt the various morbid state this medicine is capable of producing in a general manner. Okay, like suppose you have a medicine of weaker kind, you don't know whether it is a medicine or whether it is an inert substance. So what you will do, you will give it in ever increasing doses to the same person at successive days. That kuch to hai, some symptoms come, and we will able to learn whether this medicine is capable of producing this symptom or not. But we do not ascertain their order of succession. Okay, you are giving medicine in ever increasing doses. Which dose have produced which symptom, you don't know. So order of succession we do not know, and the subsequent doses often remove curatively in its state an opposite someone or other symptom caused by the previous dose, or develops instead of an opposite state. Such symptom we are referring 131, aphorism number 131. Samreen have joined us, welcome. Such symptoms, 131, aphorism number 131, Organon of medicine. Okay, such symptom should be enclosed in bracket. Okay, this is of academic importance. This is of academic importance. Those who are going through their BHMS examination or MD Organon examination, they will be asked that which symptoms have been enclosed in bracket during proving. These doubtful symptoms, we don't know that whether this symptom was produced by the medicine or whether it was a secondary reaction of the body. So such symptom should be enclosed in bracket. This is a very important honors question for your Viva examination. If you are in BHMS, this will be a normal question for your MD Organon examination. Okay, which symptom in the proving should be enclosed in the bracket? The doubtful symptom you are not sure of that this is produced by, whether this is produced by the medicine or it is a reaction of the body. Okay, to mark their ambiguity until subsequent purer experiment show whether they are the reaction of the organism and secondary action or an alternating action of this medicine. Opposite, it can be an opposite symptom, and opposite symptom may be an alternating action of the medicine. And what is alternating action? Alternating action is actually the alternating paroxysm of the primary action. And what is importance of knowing alternating action? We have discussed already in some of our previous classes. Go 2-3 class back and you will get the importance of knowing alternating action. Okay, here I will just for a quick reference refer to aphorism number 241. There are some medicine like 251. There are some medicines like ignitia, rhinia, rustrock, sometimes belladonna, whose power of altering man's health consists chiefly in alternating action. They are showing alternating action. If after administrating these medicines which are having alternating action, and there are many more medicines in proving, when you are accustomed with reading the proving, you will get that there are many medicines which are producing some opposite state. Okay, and these opposite state are not secondary action but the alternating action, because that is alternating paroxysm, means diarrhea आया, constipation आया. अगर if it was secondary action, diarrhea should not return. Okay, both alternating action and secondary action are opposite to each other, but in alternating action you will get the first symptom again, diarrhea, constipation, diarrhea, constipation, diarrhea, constipation. Okay, this is alternating action of one of our famous antipsoric, that is sulfur. Okay, allosocotina, you will get diarrhea, alternating action of diarrhea and constipation. In these kind of medicine which are producing alternating action, what Hahnemann have said, if you notice there is no improvement follows, 1, 2, 3, 4, 5th line. Okay, what you will do, a fresh and equally small dose of the same medicine. That is why we have discussed that I used to prescribe ignitia in even doses. Okay, even fractional doses. Whenever I am prescribing ignitia, I will prescribe in even number. Okay, either 2 dose or 4 dose, because it is having alternating action for all the practical purpose only. Otherwise you could wait and watch, but in modern days in clinical setup, patient will not give you that much time until and unless he is a very close relative or close friend of you. Okay, so these alternating medicine should be prescribed for all the clinical purpose in even fractional doses. Okay, leave it. Now 131, advantages of increasing dose. This was disadvantage. What was the disadvantage? That you will be unable to know the sequence of medicine, sequence of symptoms coming. And what was the importance of knowing the sequence? Because the later appearing symptoms are important. And what was the reference we have given? Laser writing, borax. Okay, and who have noted this first? Herring. Now 132. But when the object is advantage of increasing dose, but when the object is without reference to the sequential order of the phenomena of the artificial disease you are producing by your drug, and the duration of the action, these two are not your object. You don't want to observe the sequence, the sequential order of the phenomena. You don't want to observe the duration of the action of drug, only to ascertain the symptoms themselves. This is the object, especially those of the weaker medicinal substance. Underline this, weak medicinal substance. In that case, the preferable course to pursue is to give it for several successive days, increasing the dose every day. Underline this. This is one sentence end here. Many of the aphorisms of Organon, you will find that they consist only single sentence. These are the complex sentence. That is why the Organon is sometimes difficult to read, and that is what we are trying to solve: reading, understanding, and applying. Next, in this manner, the action of an unknown medicine, even of the mildest nature, will be revealed, especially if tested on the sensitive person. Okay, leave it. 133. This is same as the case taking. How you are, you have noted the symptoms in case taking. That same process should be followed in noting the symptoms. Okay, so modality. Write down the modalities. Okay, what is modalities? Modalities is which is aggravating or ameliorating the symptoms. On experiencing any particular sensation from medicine, it is useful, indeed necessary, in order to determine the exact character of symptom. Underline this. Modalities in our case taking, modalities are often very, very important. At one place in BTPP, you will see Robert is saying, you know that this BTPB we use commonly has been introduced by, means there is an introduction by Robert, H.A. Robert, that is very useful for clinical purpose, very useful. At one point of time, he is telling the concomitant symptom is to the totality what the condition of aggravating or ameliorating is to the single symptom. It is the differentiating factor. Modality sometimes is very important. There are certain drugs in our Materia Medica which have got a very peculiar modalities, some very peculiar modalities, and can be, number one, it can be peculiar. Number two, it can be very intensified. Like Bryannia's modality, you cannot forget that Bryannia is aggravated by motion. Single modality running everywhere. It is called a general theme of the general modality of the Bryannia patient. Okay, so modalities to the single symptom is very important, as the concomitant is important to the totality. We will come to the concept of concomitant and how it is it can be used in our private practice. We will come to that when we will reach 153, that characteristics, PQRS, how you can use concomitant. So modality is very important, and how to elicit this modality. Modality can be of different type. Time modality, like evening modality of pulsatilla, have never failed me. If a patient is telling that, doctor, I am all right whole day, but I am aggravated at evening, like the morning aggravation of Nux vomica have never failed me, like that 4 to 8 modality of lycopodium, never failing, of MacPhos, colosynth, never failing. These are the time modalities. Okay, those time modalities rank higher in our symptoms. If a symptom is aggravated or ameliorated at a particular time, it ranks higher than other modalities. Okay, so some drugs have some peculiar modalities. Okay, some drug like asthma ameliorated by lying on abdomen. Okay, very peculiar and very much helpful for prescribing your medorinum. Okay, anything ameliorated by lying on abdomen. Okay, there are a bunch of medicine which you can think of, like calcarea phos, like medorinum, like thyroidinum. Okay, disease is aggravated by thinking of it. Okay, there are a bunch of medicine. Disease is aggravated by thinking of it. Calcarea phos is one of the medicine. We know that it is aggravated. Other like there is Hilonius or oxalic acid. Other medicines are there with same modality or opposite modality, but these are not very useful. But calcarea phos I have seen very much helpful with this modality. Whenever I am hard or thinking about my disease, my pain is aggravated or my disease is aggravated. So very peculiar modalities, time modalities, peculiar modalities, some very intensified modalities like Bryannia, motion, किसी तरह का भी motion है, लेटा हुआ है, someone is going from nearby, he is aggravated. Opening the eyes, he is aggravated. Like this modality of Bryannia, an exact opposite modality of Rustock. So modality is important, and how to note it down, we have how to ask your patient. We have somewhat dealt in case taking. Now come to 133. On experiencing any particular sensation from medicine, it is useful, indeed necessary, in order to determine the exact character of the symptom, to assume, he is asking to the patient, the provers, who is proving the medicine, to assume various position, okay, while it lasts. When you are experiencing, you are the prover, and when you are experiencing, you should assume various position, and to observe whether by moving the part, by walking in the room, or in open air, by standing, sitting, or lying. The symptom is increased, diminished, or removed. Okay, and whether it returns on again assuming the position in which it was first observed. Whether it is altered by eating, that is position. Now, circumstances: eating, drinking, or any other condition, or by speaking, coughing, sneezing, or other action of the body. And at the same time, to note at what time of the day or night, at what time of the day or night it is usually occurs in the most marked manner. Okay, whereby what is peculiar to and characteristics of each symptom will become apparent. Whereby from this, okay, from these modalities, the peculiar characteristics will become apparent. If the patient is giving no modality, go to 153. What this symptom will be called? Without any classification, patient is saying, second paragraph, second sentence of the 153. Second sentence of 153. The more general and undefined symptoms. What are undefined symptoms? Loss of appetite. I have no appetite. Okay, this is more general. Achha, general symptom, don't confuse with the Kent's general. This is Hahnemannian general. What is Hahnemannian general? Ill-defined, undefined symptoms. Okay, the more general and undefined symptom: loss of appetite, headache. What is your problem? Headache. And we go on writing headache. This is of no use for you until and unless you resort to prescribe the painkillers, allopathic painkillers. This is no use for you. The headache, try to elicit the component. If you can elicit that headache with 4 p.m. modality, headache with 8 p.m. modality, then only you can be able to come with some medicine, some group of medicine. If you can elicit that occipital headache, aggravated by lying down, ameliorated by walking in the open air, okay, concomitant is this, modality is this, so it will be helpful for you. This symptom will be helpful. Many often in the initial practice, what we do, we follow the patient. Okay, patient बोल दिया headache है, बस headache लिख लिया. What to do? कैसे बढ़ता है, कैसे कम होता है, तो डॉक्टर को उससे कुछ मतलब नहीं है, बस headache है, हमेशा है. कैसे कम होता है? दवा खाने से. So this is not the way. And don't get frustrated if patient is telling this, that you are unable to elicit the symptom. This is your fault. Okay, in these cases where patient don't know, actually the patient don't know that what all the symptoms you need. He know that allopathic physician for a headache, allopathic pharmacist will give a simple painkiller, and they presume that you will also give a painkiller. So don't get frustrated. There is an give your patient a time, don't interrupt. Okay, patient comes to you and ask you, you ask your patient that what is the complaint, what brings you here. Doctor, I am having headache, and he started to talk. Just listen. In the very beginning, don't interrupt the patient. Okay, just listen. Whatever he is, जो भी आ रहा है आने दो. In that you will get some clue. You will get some clue in that only. Okay, at least ask कब से है, from how long it is, and if he will be able to pinpoint some causation, you will get. Try to define your symptom, but not forcefully. First, try to listen your patient, and whatever coming from his mouth, just listen, and you will get some clue. Okay, in the initial practice, this was the problem with me also. After writing whole of the symptom, I got that headache, body ache, belly ache, pain in the leg, pain in the neck, everywhere pain. No definition of no defined. Every symptom was undefined. Okay, so try to get the causation. Causation is the thing which the patient will be able to tell you if it is of recent origin. But in chronic disease, that too you will be unable to elicit. Okay, so the case taking, you should refine your case taking. And first and foremost, we have discussed first and foremost requisite for the case taking is listening ears. Listening ears. Try to cultivate your listening, then observation. No, not first. Observation is not first. Try to have a empathetic listening. Try to cultivate your listening, and you will get your symptom. Okay. So this modality is very important. By this few various positions, underline these things. Okay. Various positions: moving, affected part, walking in the room, open ear, standing, sitting, okay, eating, drinking. There are many medicine which is ameliorated by cough, ameliorated by drinking cold water. Okay, causticum. You will be able to prescribe. Why? For these keynotes these are peculiar. Allen's keynote have got some peculiar modalities. Okay, try to work out those modalities and use in your clinic. You will be surprised. You will be astonished to get a positive result. Okay, so by eating, drinking, headache ameliorated by eating, anacardium often works, or by any other condition, by speaking, coughing, sneezing, underlying these conditions, Hahnemann is telling. And now go to the Materia Medica Pura and try to read a drug. The Materia Medica Pura is a tough book. Just read a drug and note, just try to note some modalities, some of the modalities of some of the symptoms. It will be interesting, particularly those who are doing their MD in Organon of Medicine. Now, at what time of day underline any other action? These things you should underline. Number 134. 134. Write down: symptoms appear scatteredly. Symptoms appear scatteredly. All external influences, and more especially medicines, possess the property of producing in health of the living organism a particular kind of alteration peculiar to themselves. Okay, this is the first part of the sentence, ends here. All external, what all external influences Hahnemann is talking about? The morbid influences, what we have read in aphorism number 33. Is it not? Sorry, 31. The inimical forces. Inimical forces. Our existence, earthly existence is disposed to. Those inimical forces and medicines having all external influences, and more especially medicines, possess the property of producing in the health of the living organism a particular kind of alteration peculiar to themselves. Okay, ब्राइनिया खाया तो ब्राइनिया जैसा सिम्टम आ रहा है, बेलाडोना खाया तो बेलाडोना जैसा सिम्टम आया, बैक्टीरिया अफेक्ट किया तो बैक्टीरिया वाला सिम्टम आ रहा है, वायरस इफेक्ट किया तो वायरस वाला सिम्टम आ रहा है. Okay, so peculiar to themselves. What virus have affected, what bacteria have affected, what kind of external influence have affected, all those are altering health in their peculiar manner. Okay, but all the symptoms peculiar to a medicine do not appear in one person. Underline this. All the symptoms peculiar to a medicine do not appear in one person. Number one, nor all at once. Number two, nor in the same experiment. Number three, okay, not in one person, not at all at once, nor in the same experiment. Underline this line. Okay, that is, symptoms appear scatteredly. Now go, but some occur in one person chiefly at one time, other again during a second or third trial. In another person some other symptoms appear, but in such a manner that probably some of the phenomena are observed in 4th, 8th or 10th person, which had already appeared in the 2nd, 6th or 9th and so forth. Moreover, they may not recur at the same hour. Okay, Headache was at 8 p.m. in one prover, headache maybe at 4 p.m. in another prover. Okay, so this is why proving should be instituted in number of provers. Okay, because if nux vomica has 1400 symptoms, all 1400 symptoms have not been collected from a single prover nor from a single proving experiment. Okay, so all 1400 symptoms are of nux vomica, but it has not been occurred in a single prover. Okay, but that doesn't mean that these 1400 symptoms are not of nux vomica. Nux vomica is able to cure these 1400 symptoms even if it is present in one person. Okay, this is peculiarity of nux vomica. This bunch of symptoms we gathered is of nux vomica. Okay, this bunch of symptoms we have gathered is nux vomica, and nux vomica will be able to cure even if it is happening in one single person. Okay, so in proving, these are appearing scatteredly. That is why a number of proving trials are necessary. Now this is a compilation of drug proving, 135. Okay, 135 completion of drug proving. The whole element of disease a medicine is capable of producing can only be brought to anything like completeness. Underline completeness by numerous observation on suitable persons of both sexes and of various constitutions. Underline both sexes and various constitutions. Okay, underline this. You will get that some medicines are during proving, some medicines have produced more symptoms in some particular kind of constitution of the prover. By looking at the proving, that you will get in the prover sheet, there was mentioned of, there is also mentioned in what type of constitution this person is having, like robust constitution, dark complexion, physical makeup, and mental makeup of the person. You will get some drugs are giving more number of symptoms. Some drugs are giving more number of symptoms in some particular type of mental and physical makeup. Okay, so that drug, how these constitution of drug have been ascertained by these only. First, by looking at the proving. Next, by clinical application. I have told that how I came to believe that Brainia constitution is what it had been written in Allen. Once I have told you that Brainia constitution, what is written in the first few lines of Allen, these are actually the constitution of person. In every drug, best adapted, open Brainia and go. Read that. It is best adapted to person of gouty or rheumatic diathesis, prone to so-called bilious attack. Brainia patients are irritable, inclined to vehement and angry, dark or black hair, dark complexion, firm muscular fiber, dry, nervous, slender people. Okay, firm muscular fiber, dry, nervous, slender people. Exactly this type of constitution I have encountered once in my clinic. A goon of our locality, all of a sudden enter in my clinic. Dr. Babu, खांसी हो रहा है, क्यों हो रहा है? I don't know why he was having cough, but he was so irritated and he was so much of this Brainia type constitution. I impatiently, hurriedly given him a single dose of Brainia and he went away, because I wanted that person to went away from clinic as soon as possible. I don't bother to ask him any question. Just looking at the constitution, the irritation and the dry cough, I prescribed Brainia. Okay. From that period, from that patient was cured. Whenever he met me, Dr. Babu, एक single dose में मेरा खांसी ठीक कर दिए थे आप. अपनी एक single dose दिए ही खांसी टा बालू कर दिए थे. Okay, that patient is still whenever he meet, he reminded me of that incident, but he don't know what I was thinking in my mind, that I wanted to get that patient out of my clinic as soon as possible. It was my initial period of my practice. So that was a case from where I started to believe these constitutions. What is constitution actually? It is the mental and physical makeup of the patient. Okay, so how it is ascertained? It is ascertained by looking at the provings, that what type of person are giving more number of symptoms in particular drug, and that will be a constitution for that drug. Okay, how this male and female remedy have been ascertained? Same wise, whether this medicine was able to give more symptom in female provers or male provers. Now this is one set of data. Next set of that data is coming from the clinic. So we are ascertaining this is a male remedy and this is a female remedy. This medicine is having this kind of constitution, this medicine is having this kind of constitution. Okay, so both sexes and various constitutions. Now this ends the first sentence. We can only be assured that a medicine has been thoroughly proved in regard to the morbid state it can produce. Okay, that is to say, in regard to its pure powers of altering the health of man. When we are assured that this medicine have been thoroughly proved, when subsequent experiments can notice little of a novel character from its action and almost always only the same symptoms as had been already observed by others. Means after subsequent experiments you won't be able to get some new symptoms. Okay, so 136, this brings us to 136. What already I have told you, that all the 1400 symptoms, even if present in a single prover, a single patient, 1400 symptoms had been gathered by hundreds of the provers. But even if one patient is showing all the 1400 symptom of nux vomica, it will be cured. So that is the this aphorism is dealing with. Whole of the aphorism is a single sentence, one of the longest aphorism, longest sentence. All the symptoms, write it down, all the symptoms are cured in one person. Okay, so although, as has been said, a medicine on being proved on healthy subjects cannot develop in one person all the alteration of the health it is capable of causing, but can only do this when given to many different individuals varying in their corporeal mental constitution. Yet the tendency to excite all these symptoms in every human being exists in it. Okay, according to an eternal immutable law of nature, by virtue of which all its effect, even those that are but rarely developed in healthy persons, are brought into operation in case of every individual if administered to him when he is in a morbid state presenting similar symptoms. It then, even in the smallest dose, being homeopathically selected, silently produce in the patient an artificial state closely resembling the natural disease, which rapidly and permanently frees and cures him of his original malady. So summarizing is, all the symptoms are cured in one person. This is the summary of that. Okay, now 137, we were talking about the advantage of increasing dose. Okay, from there we went on to how to note down the modality and what is the completeness of proving, and if one symptom is, one person is giving all the symptoms, you can tell that one patient is having all the symptoms, your medicine can cure them. Now 137, benefits of moderate dose and risk of large dose. Write it down, benefits of moderate dose and risk of large dose. Benefit, we have discussed that even if the weaker substance, we will be able to get symptoms. The more moderate within certain limits, the doses of medicine used for such experiments are, this is bracket, line bracket, leave that. This is about the ideal prover. So much the more distinctly are the effect developed. The more moderate, the more distinctly. And only these which are most worth knowing occur without admixture of secondary effects or reaction of the vital force. Okay. When, however, excessively large doses are used, there occur at the same time not only a number of secondary effects among the symptoms, but the primary effect also come on in such a hurried confusion and with such impetuosity that nothing can be accurately observed. Impetuous means speed. Okay, so larger dose will confuse you with the primary and secondary action, plus primary action will be coming fastly. You won't be able to notice, let alone the danger attending them. With no one has any regard of his fellow creatures, and who looks on the meanest of mankind as his brother, with dim and indifferent manner, the poor will be affected with the large dose. Okay. Now go to 138. 138. So this was a benefit of moderate dose during proving and risk of large doses. Large dose may give you the symptom, but it won't give you sequence. You won't get a clear primary or secondary action. 138. Now, all the sufferings, and write it down. Significance of reappearance of symptom that appear before drug proving. There was a symptom. That is why in the prover sheet we write down any disease patient has suffered before. Significance of reappearance of symptoms that appear before drug proving. Okay, what is significance of that? I want that to complete up to clinical symptoms. Let's see how far we can go. All the sufferings, accidents. See, the accident word Hahnemann is using at many times, and there is no need to produce any means academic debate on this. Oh, okay. What is accident? What is accident? It is accident, anything new happening suddenly. Okay, not necessarily it should be a road traffic accident. Okay, road traffic accident is actually also an accident occurring suddenly in a patient's life, but this is not that accident Hahnemann is mentioning. This cannot be happen by drug. You have taken Brinia yesterday and today you have got a road traffic accident. This cannot be. Okay, all the sufferings, accident, any sudden change in life and circumstances is accident. At many places Hahnemann have used accident. First we encountered this in aphorism number 6. Okay, in aphorism number 6, accidents, morbid phenomena. Have discussed that day a lot about that. Accidents, symptoms, sudden change, any sudden change. Unfall is the German word for this accident. Okay, all the sufferings, accidents, and change of health of the experimenter during the action of medicine. Okay, provided the above condition, the condition 124 to 127 are solely derived from this medicine. Okay, underline this. All the sufferings, accident, any sudden change in the life of the experiment are solely derived from this medicine and must be regarded as and registered as belonging peculiarly to this medicine. Underline, as symptom of this medicine, even though the experimenter had observed a considerable time previously, even if that symptom was present before also, that after getting medicine as approval, the previous eruption again came back. Okay, this is also the action of medicine. Okay, the spontaneous occurrence of similar phenomena in himself. The reappearance of this during trial of the medicine only shows that this individual is, by virtue of his peculiar constitution, particularly disposed to have some symptoms excited in him. Underline this. By virtue of his, from this peculiar constitution, particularly disposed to have such symptom excited in him. Underline this. Okay. Otherwise, it is so. Some patient allergic reaction. You know, some patient have running nose by allergy. Some patient have urticaria. Why? Because both are allergy. In both, you will find that this eosinophil is high. Okay. Some patient will go in syncope. After exposure to the thing, they are supposed to allergic. Okay. So different reaction of the same phenomena. This peculiar constitution of that, they are disposed to that. Okay. So by virtue this reappearance, peculiar constitution, particularly disposed to have such symptom excited in him. Okay. In this case, they are effect of medicine. The symptom do not arise spontaneously, while the medicine that has been taken is exercising an influence over the health of the whole system, but are produced by the medicine. Okay. So significance of reappearance of symptoms. Now 139 is dealing with the literate prover, 140 is dealing with the illiterate prover. Okay. So again, what to do in literate prover? You are giving your sheet of medicine to the prover, prover's day book, and again when they are coming, you are re-examining. But for the illiterate prover, they should be consulted daily. Both the illiterate and literate prover should be consulted daily regarding their modalities, regarding their different circumstances of their occurring. So read it by yourself, 139 and 140. 141 is dealing with the best prover. Okay, obviously best prover is the physician himself. All the credit for establishing Hahnemann homeopathy is actually goes to provers. Okay, the followers of Hahnemann who risk their lives for giving these symptoms. Okay, many provers have like hearing, while proving Lachesis, he was never able to wear a tie again. After proving Lachesis, he was never able to wear a tie again. These kind of stamp of the medicine occurred on the provers. They risked their life. The initial provers risked their life to compile this book of to compile these symptoms which we are using now. We should be grateful to them. So by the way, who is the best prover? Best prover is the physician himself. Okay. But the best proving of the pure effects of simple medicine in altering the women's health and of artificial disease and symptoms they are capable of developing in healthy individuals are those which the healthy, unprejudiced and sensitive physician institute on himself with all the caution and care here enjoined. He knows with the greatest certainty the things he has experienced in his own person. Okay. Now this is a long footnote here. I just want you to go the Greek word, that is know thyself. 1, 2, 3, 4, 5, 6, 7th. 1, 2, 3, 4, 5, 6, 7th line in bracket. You will get the foundation of all true wisdom, and then a Greek word is there. Okay, that is know thyself, meaning know yourself. Okay, meaning know yourself, know thyself. So by proving, he will be able to understand his constitution and what all symptoms he is disposed to, what kind of disposition he is having. Okay, so knowing himself, and it will be, read this paragraph. This is especially a philosophical footnote. Read this and you will enjoy it. Of late, we are unable to finish our this clinical symptoms, clinical proving. We will discuss in next class. Okay, we have no time left to for further discussion. 142 is dealing with the clinical symptom. We will deal with next class. Thank you.